Hello friends, I am Dr. Harmeet Goel, your OBS Gynae faculty. Today I am discussing another clinical case scenario of the septate uterus. So septate uterus is the most common congenital malformation which is associated with either infertility or with the recurrent abortions. So a very close differential diagnosis of a septate uterus is the bicornuate uterus, which is a type of Mullerian duct anomalies. Now, a 28-year-old female presented in the gynae OPD with history of 3 recurrent abortions between 12 to 14 weeks duration. So it is usually a second trimester abortions here in this question. She has got blood sugar done, lipid profile, lupus anticoagulant and anticardiolipin antibodies. This is to rule out APLA. APLA means antiphospholipid antibody syndrome. TSH, that is like to rule out any thyroid disorders. This all came normal. Blood sugar, lipid profile, tests for antiphospholipid antibody syndrome, TSH to rule out any thyroid disorders responsible for recurrent abortions. Ultrasound was done, showed some anomaly. Which type of anomaly? That was not mentioned. Then cervical length was also found to be normal. So they have also ruled out the cervical incompetence by checking the cervical length. So cervical length was also normal. The blood sugars were normal. So there was no diabetes, no thyroid disorders, no antiphospholipid antibody syndrome, and no cervical incompetence. Then HSG was done, hysterosalpingography, which showed uterine anomaly. This is shown in this image. So what type of presentation do you find in this HSG image? Whether it is a septate uterus, bicornuate, arcuate or unicornuate. Since I can see the 2 cornua in this HSG image, so it is not unicornuate uterus. Arcuate uterus, usually the pregnancy outcome is uneventful and usually does not present with abortions. So that is also been ruled out. So the differential diagnosis is between the septate uterus and the bicornuate uterus. Since the angle of the 2 cornua appears to me as an acute angle and usually it is around less than 75 degrees angle. So this appears to me a case of septate uterus, but I would like to keep a image of the bicornuate uterus as my differential diagnosis. So the difference between the two is in the septate uterus the angle is acute angle and it is 75 degrees, and where in the bicornuate uterus it is an obtuse angle of 105 degrees or more. So that is the differentiating feature. What is the nowadays the modern modality to diagnose the Mullerian duct anomalies is MRI scan or 3D ultrasound is fair enough. That is the investigation of choice. But I would like to treat this patient. So I am taking up a next step of hysteroscopy plus laparoscopy. Number 1, it will confirm my diagnosis. Number 2, I can do the therapeutic treatment of this uterine anomaly because the female has presented to me with the history of recurrent abortions. So I need to diagnose the case and I need to provide the treatment. So I am planning a laparoscopy plus hysteroscopy in the same setting because patient has been given the general anesthesia. So septate uterus is the most common uterine anomaly which is leading to the recurrent pregnancy losses, and the septum usually is the fibrous septum, okay, but there can be some little bit of vascularity that might be present. Septate uterus is associated with subinfertility, preterm labor, reproductive failure. Nearly 15% of the patients have recurrent pregnancy losses, okay. There are 3 types of septate uterus. That can be a septate, that is partial septum, where the septum is limited to the uterine cavity. Number 2, it can be complete where septum goes till the cervix, or it can be septum going till the vagina. So there are 3 subtypes of the septate uterus, and Doppler ultrasound can show some vascularity in the septum, and MRI is the modality of choice for the diagnosis of Mullerian duct anomalies. Here in this case, I will do laparoscopy plus hysteroscopy. So this is HSG image. This is laparoscopy. However, on laparoscopy, very difficult to comment upon the septate uterus. It can comment upon the bicornuate uterus. And number 3, I talk about the gold standard investigation. Gold standard investigation here will be hysteroscopy. Now, while I am doing hysteroscopy, in the same sitting, I can do the resection of the septum. So, hysteroscopic guided resection of the septum. While I am doing hysteroscopy, I might not perforate the uterus. To avoid perforation, I will do a guided laparoscopy. Okay, so that is why the lapro and hysteroscopy are combined when you are treating the Mullerian duct anomalies. Okay, so here this is the bicornuate uterus, and laparoscopically the metroplasty can be done in cases of bicornuate uterus. So this is what is a close, like differential diagnosis of a septate uterus, that is a bicornuate uterus. So hope this video was informative for you. So I will bring more clinical case scenarios in my next videos. So stay connected, and thank you.